Good afternoon, everyone. We're all welcome to this webinar and talking about answers to frequently asked questions on fibroids. This webinar came up as a result of like a sequel from the virtual launch of the book Fighting Fibroids. I noticed that a lot of people were asking me questions. People wanted to know about their fibroid status. People just had, a lot of questions. And again, people are private about their issues again. But then again, if you have a problem, it's important that you talk about it and, get the required support and help that you need. I want to especially welcome Dr. Ayeni Ayokunle, a consultant gynecologist. In fact, he is my gynecologist. And I'm so grateful to you, sir, for the role you played, when I had to undergo a hysterectomy, your counseling, providing clarity. It was really encouraging. And one of the things that I really enjoyed that time was the ability to be able to reach out to you on WhatsApp with whatever questions I had pre the surgery, and after the surgery. That really helped me, and I really appreciate it. And I think that's how it should be, with having access to our doctors. Thank you so much, sir. Yes. I also want to appreciate Shogo, my tech guy, making it happen. Thank you for your support as always. So we're going to be digging into our conversation this afternoon. Next slide, please. Basically, the agenda is not a lengthy webinar. I'm just going to do a little introduction about myself, and then the Dr. Ayeni will dig in straight up, and then we wrap up. If there are any other questions, people can actually ask. So, but before I talk about myself, I want to wish people a happy International Women's Day. I would like that slide to come up, Shogo. I would like this slide to come up. Next slide. Work with me. I need you to work with me as I'm talking. All right? Work with me. So I want to wish all the women a happy International Women's Day. It is the reason why we are having it today, because this is the Women's Month. The men have said that they don't even know how many International Women's Day are in the calendar, in year's calendar. But we are special now. We are women. We are special. We celebrate every woman out there supporting their men, pursuing their careers, their businesses, standing by for their families, and we celebrate the men supporting us, the women too. And right about now, I want to quickly talk about myself. I wrote the book Fighting Fibroids. My name is Adebisi Adetunji. I am a media and communications professional. I love storytelling. I worked basically in the mainstream media broadcasts for over 20 years. And I love development work. I love helping my community. I love social work. I love doing things that impact people. And I'm a storyteller. So which is why I have written 2 books, and this is my latest, Fighting Fibroids. In this book, I just basically shared my fibroid story journey. How it all began when I first discovered it, at the conception of my first child, my son. I went, to do a scan, and the doctor was saying, "Hey, madam, congratulations, your baby is kicking butt," and the fibroid news tainted the news of, my baby kicking. And we rolled with it, I and my husband, for several years. Initially, I thought I would live with it for the rest of my life. That since medically they said people actually live with it for the rest of their life if it wasn't disturbing anything in their life. And so I rolled with it. But of course, again, fibroids were getting bigger. They were multiplying. And it became very uncomfortable, affecting my work, affecting my health, affecting my my well-being, my intimacy relationship with my husband. It was just, it became very uncomfortable. And I had a real long journey of finding out what are my treatment options, because there's a lot of information out there. People have a lot of information about what you should be doing about fibroids. And some of it could actually, land you where you don't want to land. And some can prolong, your situation. And I found out that some people end up using things that ended up damaging their kidney and all of that. The Dr. Ayeni, will speak to all of this in our conversation. So I was kind of really, really skeptical and careful. Eventually, we decided that, we had finished having our children. Why don't I just go ahead to remove it? And then finding a doctor and a hospital was a big deal for me. But eventually, we landed in the right place and with the right doctor, and here we are today. So I wanted to, feel free. I'm happy that you are here. You're going to be hearing and learning a lot from Dr. Ayeni. He's going to be answering some of the questions women like me have, in their hearts, and the answers are not just really out there. It seems that there's a lot of information, but the truth of the matter is, when you don't have people that can tell you that this is the problem and have access to the right professional person to really guide you, people tend to, do things that eventually harm them, and um, you know, unfortunately, some people, lost their lives, and we don't want that, which is why we are doing this webinar straight away, straight up, because we want to keep to time. I want to welcome, Dr. Ayeni, who will be taking the floor. I will be asking the questions, but he will be providing the answer. So right about now, Dr. Ayeni, you have the floor. Let's have the first question slide. Let's start with, what are fibroids?
Okay. Well, good afternoon, everyone, and thank you once again for this opportunity given to me to talk about a very important topic that affects women all over the world, especially in these environments. And I also want to use the opportunity to also congratulate all women on this occasion of the International Women's Day, which one of the goals is to achieve gender equality, women well-being in the aspect of life. Now, uterine fibroids, like I said, is a common condition in women, and it's commoner in Black women, and it's one of the causes of reduced quality of life in a lot of women because of the symptoms they could be experiencing from fibroids. So, what are fibroids? Fibroids that some people call leiomyomas, myomas, fibromyomata, they are actually benign tumors. What do we mean by tumors? Abnormal growth of cells in a tissue. So the fibroids are abnormal, so they are tumors, benign ones, because they are not cancerous. That is what benign means. They are benign tumors, and that occur in women, and it's a tumor of the uterus. In fact, it's the most common tumor of the female reproductive tract, and it tends to occur in women in the reproductive age group, in which we mean women in the age bracket of 15 to 49 years. And one thing we know about them is that it's commoner in blacks, about 3 to 4 times commoner in blacks than in their Caucasian counterparts. And it's a major concern, especially if a woman goes to a doctor for a complaint, now required her doing the scan, and she's now being told that, oh, during evaluation we find fibroids, and it becomes a concern if whether it's company symptoms or not. So it is important to know what these fibroids are.
All right. Running along to the next question. You already mentioned that fibroids are not cancerous.
Yes.
You might want to explain this further to some people,
Yes.
some women who are not really sure whether, some people may think somewhere along the line it can become cancerous.
Yes. Now, like we said in the introduction, fibroids are benign tumors. But it's also important for a woman to understand that sometimes, even when they have some symptoms that they feel is as a result of fibroids, there are other differentials. There are other conditions in the woman's pelvis that could mimic fibroids. There could be an ovarian tumor, there could be adenomyosis, there could be an endometrial hyperplasia, and endometrial cancer. So that's why it is important to always go to the right doctor to evaluate a woman properly. Because generally, like I said, fibroids are not cancerous. The only instance where a fibroid, though rarely, that some studies, research have shown is when you have a fibroid later in life, and which occurs more in the postmenopausal period, is when some of them do change, undergo some changes and become what we call sarcoma. So what we call leosarcoma, but it's very, very rare. It's a very, very rare condition.
So let me understand, sir. What you're saying here is that if a woman becomes menopausal, right?
Yeah.
And she has been living with fibroids for a long time.
Yeah.
The fibroid can, in rare cases, change to become
in very rare cases.
Very
and
rare,
in
but it can.
most times, what the way those women present is that they usually come with recurrent pains, recurrent abdominal pains. And by the time they are evaluated, you will see fibroid nodules. Some of them would have undergone some changes. But like I said, it's a very, very rare condition.
Rare condition.
It's rare with about 1%. The fibroid.
That's one in how many women, sir?
Well, you can say one in maybe 1,000.
Oh, 1,000.
Very rare.
Okay.
Yes, very rare.
It's good to know. So let's move on to the next question. Yeah. What are the symptoms? How would a woman know that she's experiencing, fibroids?
Yeah, thank you very much. Now, it's also important to know that not all women will have symptoms from fibroids, which is another important point that a woman should know, because we've seen some women fall into the hands of some desperate people who want to make money out of them. Once they show scans that they are fibroids, whether they are causing problems, they will tell them they need surgery, they need this kind of treatment. No. And for every woman that has a fibroid, not all of them will have the same symptoms. The commonest symptoms that we do have from fibroid is heavy menstrual bleeding.
Oh.
Yes, heavy menstrual bleeding is the most common. This could come in the form of heavy periods, which will even last within the normal menstrual days, or they could also have prolonged bleeding episodes. This is one of the commonest, what we call under abnormal uterine bleeding. We've also seen some women who come with dysmenorrhea, which is pain during their menses. Some women come with dyspareunia, which is painful sexual intercourse, especially for fibroids that are located in the cervical region. We also have women who come with pressure symptoms. What we mean by pressure symptoms is that because of the weight, the bulkiness of the fibroid, they compress on some of the pelvic organs, like compressing on the bladder, which now kind of decrease the capacity of the bladder. And therefore, any small amount of urine, the woman wants to urinate as soon as the bladder feels like, oh, you have to go. So she comes with this frequency as a complaint. Some can also even come with urinary retention, because if there's an obstruction to where the flow of the urine is meant to go from the bladder to the urethra, some women we've seen before, they come with urinary retention, difficulty with passing urine. Also, this same fibroid, if it grows posteriorly, it can compress on the rectum and make a woman be prone to having constipation, because the feces will not be able to move freely. Other forms of pressure symptoms is people complaining of pelvic pain. You see a woman coming that will have been having this pelvic pain, back pain for a number of years, and we don't know what the cause is, but fibroids can present with such pressure symptoms. Now, in some women, they might not have visible symptoms, especially the ones whereby the fibroid is growing laterally. They can compress on the ureter, which is the structure that carries urine from the kidney to the bladder. And when you have that, sometimes you can have the total compression of the ureter, which will not have backflow of urine. And after a long time, that can damage that urine. In fact, about 3 weeks ago, I operated a patient here who the complaint that she wasn't even a complaint. She went for a general yearly evaluation, did a scan. Yes, and they found out that she was having a dilated ureter because the fibroid she had was compressing on that right ureter. So that was why we had to go in to relieve that pressure. So those are some of the symptoms.
So when you talk about ureter, Masa, that's the bag carrying the urine?
Yeah, it's like a pipe from the bladder. There are 2 of them because we have 2 kidneys coming from the kidney to the bladder.
Okay.
Okay.
So what?
There's a
How
pipe.
can that? How can that? What is the implication of that?
Yeah, the implication of that is that if the two ureters are compressed and urine is not flowing freely, one,
Yes.
before you start have stasis of urine, you can increase the chances of having infection. Someone will just be
Oh.
having recurrent urinary tract infection. Before the woman knows it, it will involve the kidney. The woman will have, they might have pyelonephritis. From there will be kidney failure.
Oh.
Yes, those are
Oh.
some
Okay.
of the
So
complications
if
that
it's
can happen.
compressing or complication, if it's compressing on the ureter, that's the
Yes,
kind of complication. Oh
yes, those
wow.
are some of the complications the woman can experience.
Moving along now to our next question. Are fibroids treatable? That's the big question on the minds of many women. What are the treatment options? Again, people are running all over the place trying to get a treatment option.
Yeah, the fibroids are treatable. Any form of fibroid can be treated. Though we do say that there's this expectant management option for women who don't have symptoms or maybe mild symptoms that they know that they can tolerate. But for the ones that do require treatment, it now depends on one, the symptomatology. What do we mean by that? This form of symptoms the woman is presenting with. Because a
Okay.
woman who comes with heavy bleeding or prolonged bleeding, a treatment option will be different from someone who comes with maybe recurrent pregnancy losses, which is one of
Okay.
the clinical features I didn't say, but though it's not a symptom, but can be a complication, can result from fibroids in the womb. Then, now one of the treatment options that we'll talk about is medical treatments. Medical treatments entails various um, approaches. There are sometimes we use just pain relief for women who are complaining of pain.
Okay.
Pain reliefs, maybe the mild analgesics or the strong ones like the opioids or the non-steroidal anti-inflammatory drugs. Sometimes we also make use of drugs that will reduce the blood flow. There are some hormonal medications that can be given to women or some antifibrinolytic agents that will help reduce the menstrual flow when they're experiencing heavy periods. There are
Okay.
also some hormonal drugs that we give that will mimic a menopausal state. What I mean by that is that they will shut off the woman's ovulatory function. That the woman will not menstruate for the period she's on that medication.
Okay.
But the drawback with those medications is that we cannot use them for a long period of time because of the side effects of the postmenopausal symptoms she might now start experiencing, like hot flushes, bone loss, some maybe some emotional conditions like anxiety and all that. We don't tend to use them more than 6 to 9 months. Those are some of the ones that induce a postmenopausal state. Then, apart from medical treatments, the other options are surgical, which could be removal of just the fibroid in open myectomy. It could be hysterectomy for some women. Like I said, it depends on her symptoms, her age, and also her plan for future fertility. If a woman comes in her 40s, she has completed family size, of course, we want to counsel them for removal as an option. Of course, other options will also be discussed with them because some women in this part of the world believe that they don't want part of their organs to be removed. They want to come clean,
Yeah.
came and all.
Yeah.
So that's some of the challenges we have. So they would rather have the fibroids being removed because I had a 48-year woman recently. She said, "Oh, she just wants the fibroids removed. She has 3 children. She's not planning to have anymore, but she said, oh, it's just the fibroid." Now, those are invasive procedures. There are some other minimal invasive procedures, approaches, like the laparoscopic approach, in which just a small incision will be made in the abdomen to get access to the womb. But in those in that form of treatment,
Yeah.
it's selected fibroids that can be treated in those cases. Maybe
Okay.
the ones that are polypoidal, the ones that are very close to the surface covering of the
Are they
uterus.
are they are they small or big?
Yeah, most times they are small fibroids, single fibroids, not the ones that are really deeply embedded in the muscle of the
Those
womb.
ones can be treated
We
with
cannot
laparoscopy.
laparoscopically because there could be complications. That's why we need to individualize the patient when we talk about some of these surgical approaches. Then there's also the stereoscopic approach, when they go through the vagina into the uterine cavity, mostly for also the ones that are in the endometrial cavity. And also, there is also the uterine artery embolization, which is done by the interventional radiologist, in which the major blood vessel to the womb, they will introduce some particles that will block that blood vessel. So the blood supply to the fibroid will be shut off. So preventing the fibroid from growing. Also is also used in women who have heavy bleeding. That's another treatment modality. And also there's also the option of using ultrasound nowadays, especially the magnetic ultrasound, which this is what we call the MRI guided focused ultrasound surgery. The woman is a day procedure. The woman goes, if she meets the criteria for it, they will focus the ultrasound rays on the fibroid, which with time it will shrink, just shrinking. But at times, the woman might need more than 1 or 2 sessions of this. And it's not a treatment modality that is available everywhere. But the most important thing is that fibroids are treatable. But it is important for a woman not to just fall into this into the hands of some doctors who just want to treat a woman whether she needs it or not. Go to the right person, let them evaluate you, and let them give you the best treatment option. Sometimes you can even start medical. If a
That's
woman
using drugs first.
Using drugs, if she doesn't want surgery for the time being, or maybe she's not fit for surgery, we can start with medical treatment while we work out for surgery. Surgical options is not always the option all the time. Medical can work for some women, while in some women, the surgical approach is the best.
Yeah, this makes a lot of sense. So it's important that every woman is evaluated for the proper treatment for her. Next question.
Yes.
So, well, you've talked about medical orthodox medicine that can help shrink already. So let's just move on to the next question, because you talked about this just a few minutes ago now. Question 6, let's quickly go to the next question. Now, fibroids and fertility, you know, this is a big issue. So can fibroids affect fertility? Maybe we should just put it together with the next question. What can a woman and couples do? I know you can't answer all of those questions. This is just a tip of the iceberg for people that we'll also put out there for people to listen to, but we'd like you to talk about this. Yeah,
well, it's a very important question, because we are faced with this in almost all of our gynecological clinics. Women come with infertility issues. Then maybe because of evaluation somewhere, they found fibroids. They will say, is the fibroid, is this? No. When a woman comes with inability to conceive, or when a couple come, yes, we want to evaluate the two. Now, if the husband has been taken care of, the woman, what are those conditions that can cause infertility? Even if they have fibroids, we don't take that as a priority. We want to evaluate for other things first. Because in this our own environment, the most important factors are factors that have to do with our ovulation and also the reproductive tracts. Now, in some instances, you've seen fibroids that are big inside the uterine cavity that can block what we call the corner, the space, the holes where the fallopian tubes open into the uterine cavity. You've seen instances like that, but before we even decide and say, oh, this is the probable cause of infertility, because it is preventing the male spermatozoa to enter that opening to go and meet the eggs of the woman. We want to do some tests to ensure the patency of that tube. When we run those tests and we feel that, oh yes, it could be from the fibroid, then we can say, okay, let us remove this fibroid. We will do the test after the procedure to also ensure whether the tube is now patent or not. Of course, the woman will have the adequate counsel. That's one of the not so common ways they can prevent a woman from getting pregnant. Some other people have mentioned some other theories that, when there's a fibroid that makes the uterine cavity too long, it will be difficult for the sperm to ascend, and all that. But those are just theoretical explanations. But the most important thing is, if having a fibroid doesn't prevent pregnancy. A woman can
all the
get
time,
pregnant
but
with
it can.
fibroid.
But it can.
It may, but it should be good to evaluate for other things before you
Okay.
now see it in the fibroid. Because if a fibroid is outside the woman's womb, even if it's as big as a football, the way a football, but it's outside, it won't
Yeah.
prevent her from getting pregnant.
Pregnant.
You understand?
Okay.
So
Okay.
that one would possibly be causing pressure symptoms. I've seen some women come to us with fibroids, pregnant women with fibroids that are as big as the baby when they deliver. Big
Wow.
fibroids.
Wow.
Yes, whether in the womb or not. So it doesn't, a woman has to be evaluated thoroughly. Fibroids are not
Medically.
really, yes, not really like 100% sure that it causes infertility.
Infertility.
Yes.
Okay.
It can cause problems they can make it challenging when a woman gets pregnant.
It's pregnant.
But that it cause infertility,
No.
not really. Not it hasn't been proven scientifically. Everything is just theory. Yeah.
Okay. So you have to be evaluated before you
Definitely.
conclude that it's the fibroid that is causing
Might be the fibroid. Yes.
Yeah. All right. Thank you. Next, moving on quickly, we have about 15 minutes thereabout. So in this instance now, the fibroid, the woman gets pregnant with fibroids. How can this affect, and what, maybe in few words, how should such a woman be managed? How should she manage herself in pregnancy?
Well, if the woman is pregnant with a fibroid, it's sometimes the fibroid, though, yes, because of the hormones pregnant, the fibroid might grow a little, not much. It's not all women with fibroid pregnancy that will have issues when they're pregnant. But some do have, and we can group this into those ones that can happen in the early part of the pregnancy and those ones that can happen in the later aspect of the pregnancy. Now, like I mentioned earlier, we said that sometimes fibroid can cause miscarriages. Yes. In fact, fibroids that do distort the endometrial cavity, the lining where the pregnancy is meant to implant. Studies have shown that those that distort that cavity can cause a miscarriage because it doesn't allow good implantation. In fact, we always advise that if a woman comes, does a scan, and she has fibroids, no matter how small, that are distorted the endometrial cavity, we advise that she should have it removed. Yes. Even those gynecologists who do IVF, once they see fibroids that distort the endometrial cavity, whether the woman having symptoms or not, they will advise her, go and have them removed before you IVF because of the chances of success for the IVF. Okay. So in the early parts, it can be a cause of recurrent miscarriage. Also, there are some changes that do occur in pregnancy in terms of the blood supply to the fibroid, in which there could be some changes inside the fibroid. There will be necrosis within the fibroid, which will now cause some release of some inflammatory mediators that can cause pain. So a woman can experience occasional pain, what we call acute red degeneration of fibroid in pregnancy. In fact, we've seen some women be admitted every now and then because of this pain, if it's very severe. Some of these pains can be managed at home with mild form of analgesia, paracetamol, bed rest, hydration, but at times they can experience pain. But like I said, it's not in all of them. Also, when this happens at times, as the pregnancy progresses, a woman, because of if there are big fibroids and it causes distension of the womb, it can cause what we call preterm contraction. Sometimes the woman can experience preterm contraction. Even from the changes that are happening with the fibroids, because of the release of some mediators, it will just irritate the womb, and she will have some episodes, at times, some contractions that will necessitate coming to the hospital, giving treatments, and with time, that contraction will subside. That's another way it can affect pregnancy. Another way it can also affect pregnancy is that it can also determine the mode of delivery. Because if you have a fibroid that is in the lower part of the womb and is big enough to prevent the baby from passing through the cervical canal, you might want to advise a woman to have a cesarean section because this has happened before. So, and yes, and of course, once a woman delivers, if there are fibroids, it also increases the chances of having what we call postpartum hemorrhage. Because those fibroids, especially if they are big and multiple, they don't allow the womb to contract very well after delivery. So it
So it
makes a
can
woman
lead
to
to
bleed
bleeding.
more. Yes.
Can lead to
So it can
bleeding.
make a
Okay.
woman bleed more. So we do advise a woman when she comes in or she concerns that, oh, I have fibroids in my pregnancy, we will tell them what to expect, what to do if this occurs, and also how to prepare them for their delivery. Because
So
it's not
that,
all fibroids, whatever, even if they are big but they're outside, it doesn't
it's
affect a woman's going for maternal delivery. But the
pregnancy.
ones that do cause obstruction lower down in the uterus are the ones that most times will make a woman have cesarean delivery.
Yeah. So that means if a woman is pregnant with fibroid, it's important she's properly registered in the hospital and ensures
Definitely.
that she's
Yes.
managed properly. So that
That's
makes a lot
correct.
of sense. I think we'll just take maybe about 2 or 3 more questions. And so we've just talked about this now. So running along to question 9. So when is hysterectomy prescribed for a woman with fibroids? Basically, maybe just a brief about what hysterectomy is, and maybe if your doctor prescribes it for you as a woman, should you feel safe? People are concerned and worried.
Yeah. Okay, thank you. Well, hysterectomy is a treatment option. In fact, it's one of the most common procedures done abroad for women, like in the US, because of fibroids. Now, it involves removal of the womb, the fallopian tubes. Then, sometimes with the cervix, which is the lower part, the lower end of the womb. It may or may not involve removal of the ovaries. Okay, because at times a woman, once she has been explained to that, okay, the option best for you is hysterectomy, we actually, oh, she will ask you, oh, but at this age, if you remove it, I'll become menopausal. Yes, there's the option of us leaving the ovaries in there,
Okay.
you having the ovaries removed.
Okay.
A lot of factors comes in when it comes to counseling for this, because we want to control if a woman has a family history of ovarian cancer and she has the opportunity to come for, maybe she's 40, she has completed family size, and she has the opportunity to go for a fibroid surgery. And you counsel her, oh, because of your history, your age, oh, I think you think the best is for you to have your womb removed and also the ovaries because of that risk. But
Okay.
in those who don't have a family history and the risk is not there, they are still in their early 40s, and we still feel that hysterectomy is the best. They also have the option of preserving their ovaries.
Okay.
Okay. Now, one important thing, one important condition that determines the option of hysterectomy, like I said earlier, the age of the woman. Hysterectomy will not be recommended for a woman, a young woman, maybe in her 20s or in her 30s.
Okay.
It will not be recommended for a woman who is still desirous of future fertility, that still wants to have children. In fact, if a young woman who has 4 children comes and she's 28 years old, 30, we will still not recommend hysterectomy.
Okay.
So, yes, but for a woman who is above 40, 40 and above, who has completed family size, we will mention hysterectomy as a treatment option, but also other alternative. It is for us to give her enough information for us to now decide which one she
Which one she
wants.
wants? Okay.
Yes, doctors, we gynecologists will not impose a treatment option on you.
On you.
What we will advise, because if the fibroid is causing pressure and a woman is in her 50s, she has completed family side, I mean, it's better she just have it removed. Though we still see
Yeah.
someone who say, we want just the fibroid, I want to have my womb, I don't want my womb removed. But the onus is on us to give them proper information so that they will now decide. But for women who have completed family size, older women, hysterectomy will always be recommended for them.
All right. Thank you. Clear now. I like the fact that there's clarity about who hysterectomy is recommended for. Quickly, I think we'll just have 5 minutes more on the questions, and then we'll do wrap ups. So So how can a woman or the family prepare? What should we expect before? I'm not expecting you, sir, to say everything. I mean, this is a short, but just tips for preparing and laying our fears. After you have done the surgery, what are the things do you need to do, on your way to recovery? All right, sir.
Well, yeah, thank you very much. Well, in preparing for surgery, whether fibroid surgery or any surgical procedure, the most important thing first is for the person to be evaluated appropriately to make sure that they are ready and fit medically, psychologically, emotionally for the procedure. Because it's really always a challenge and always difficult for people to come and say, oh, I want to have surgery. It's very rare to someone to come and say, oh, especially for the first time. So it will always be good to be mentally prepared. In fact, a lot of times you see the woman come in, you will tell them what they need is surgery, then they will go away for a long time till they are preparing, maybe financially, emotionally, physically for it. It is allowed, especially when it is not a life-threatening condition. So it's always good for them to, because it also gives them time.
I think it's the network. Dr. Ayokunle, we can't hear you.
I can hear you.
Yeah, we lost you at the point. So you said something about them preparing. So just take it from there.
Yes. So it's that period of preparation will give them time to, in terms of, oh, who is going to be with me at surgery, who is going to take care of my family, financial aspects, spiritual aspect of it. Then, of course, there are some basic tests the woman will run to be sure, like I said, that she's fit medically. We always want patients to come in when they are coming for surgery, coming with a good state of mind. So that's why we always give them time, because we have to release their fears. Because we've seen a woman, even at the point of being in the theater, saying she doesn't want surgery anymore because of the fear. So at that time, we need to work on that for women. Be sure that, yes, all this has been taken care of before they come in for surgery. Even at the point where they move them to the theater, it will still be good for us to talk with them, calm them down, and reassure. So all this will be done before the surgery day. And after the surgery, once the woman goes in, we always say you'll be given some period to stay off work or some physical activities for you to recuperate. Then, of course, in terms of what you eat, it's a gradual process. We don't want you to rush to eat some hard meals or heavy foods. It's a gradual thing. Gradual thing as your body heals. Oh, but a woman can eat what she has been eating before surgery, after her surgery. You don't have to say, oh, this kind of food. Someone says, oh, you can't eat this, you can't eat that. No.
And some people talk about bowel movement, that you have to eat things that help aids your bowel movement. Again, those are some concerns. Is there a type of nutrition?
No. That's why I said that you can eat all the things you were eating prior to surgery. In fact, nowadays, the period at which we may say a woman should not eat after surgery has been shortened, because if we did not touch our bowels, and the surgery wasn't so extensive that it involved the bowels, then there's no reason why we should make her stay away from eating food for too long. So
there's no special nutrition for after surgery.
If for some cases that have to do with other specialties, maybe because of a particular reason or something, medical condition, they will let you know that, oh, these are the food you should eat to aid this, to prevent this. But when you do fibroid surgery, hysterectomy or myectomy, you can go back to we encourage good nutrition, balanced diet. Eat your proper normal food, take fruits and all that. Go back to what you already do as your body heals and as you can tolerate it. Because I will say, oh, I've had this surgery, I cannot do this, I cannot do that. No. We will tell you once your body heals, because every woman knows their body. When you know that you can handle this, then you can start. You can start your physical activity.
But how do you draw the line between overdoing it?
That's why we always say, after any major surgery, 4 to 6 weeks off work, if it's possible. Then from there, you can start resuming your normal activities. because we know that in some women, in some people, it takes time for them to actually come to that, oh, yes, I'm mentally ready, I'm physically ready to resume activities. It varies with people. So we always give that period of time. If a woman now comes after that period that, oh, I still feel I'm not yet, we will reevaluate and, oh, she needs more like time off from work, we'll advise as appropriate. So it doesn't really matter really.
Okay, so your final words for maybe in another, if we have another opportunity to record, another session with you, sir. We don't want to keep you because you have we've talked about nutrition. You are going to be on duty very, very shortly. So your final words for women, on fibroids treatment, concerns. I mean, based on your experience, what would you like to say?
Well, I want to advise women that if they are found to have fibroids or they develop symptoms, they should not make it like a death sentence that, oh, this is a problem that I have to be running up and down to do this. No, seek appropriate medical advice. Go to the appropriate doctor. There are a lot of health practitioners out there, and also experience matters. Okay, when you find out that you have fibroids, go to the appropriate person. Let them give you appropriate advice in the terms of the treatments modality you can have, whether you require treatment or not. They should not indulge in using herbal medicine.
Mm,
Herbal medicine have a way of causing a lot of problems. We've seen
mm,
women who will say, oh, my colleague said I should be inserting something to the vagina. It will
mm.
make it melt. It
Wow.
has serious implications. We've seen women have what we call gynaecologist, in which the vagina will close together from
Wow.
the fibrotic nature because of the um, erosion that has been caused by what they were inserting. And even
Wow.
after the problem of the fiber has been taken off, that will not be another problem. We've seen
Problem.
women lose their husbands because of that, because
Wow.
of gynecologist. So we advise that a woman who discovers that she has fibroids should please go to the appropriate doctor. And if they're not comfortable with what the doctors give them, they have the option of going to another person to seek
Mm.
better
Another
advice.
doctor, yeah.
So it is, yes, it is very, very important because, like I said, you have a fibroid doesn't mean it's going to cause symptoms for you, or you're going to have to need any treatment, or even you don't have to have surgery depending on your symptoms.
Thank you so much, Dr. Ayeni.
Thank
I think
you.
we'll take Shogo, can you take a screenshot of everybody here before we, run along? And maybe you can put the last slide while I quickly talk because I want us to close in the next 2 minutes. Our time is up. Just put the last slide where I'm talking. I don't know if anybody on the call has a question because we didn't give them. Does anybody have a quick question? Anyone? Any concern? So we don't shut people out. Okay. Anyone with a question or concern? Okay. I'm not seeing anyone. So again, I just want to quickly talk about, okay, Funola has a question. So please unmute yourself and ask the question, please.
Okay, thank you very much. Thank you, Mr. Adebisi, for this thing that you put together. And happy International Women's Day. Thank you, Dr.
Same
Ayeni.
here.
So my question is, so after a woman has had a hysterectomy, there are concerns, for example, about life after hysterectomy. So, for example, let's say bone health, let's say for some reason, because of shortage of estrogen, there is bone issues. What would you advise? What are the kind of supplements a woman should take? What are the things we should look out for and do to improve life after a hysterectomy? Thank you.
Yeah, thank you very much for that question. It's a very important question. And yeah, if hysterectomy is done and the ovaries are removed, which will cause going to the state of being menopausal, there are various treatments options available to replace those hormones lost from the ovaries. There are some hormones that are available now. The patches are available, the oral ones are available, even the vaginal creams for vaginal dryness that some women complain about. In terms of bone loss, we always advise that good exercise, good nutrition, some vitamin D supplements, bisphosphonates. Those are some of the options that are available. Avoid alcohol, if a man drinks alcohol, but maybe just little amount of alcohol, and good exercise. That will strengthen the woman's bone structure. So that's enough good fruits, vitamin D supplements, calcium. Those are some of the things we'd advise that a woman will be on. So with that, there shouldn't be any problem at all. So it's
So
part
those
of the,
those supplements, sir, is it, you know, is it a regular daily thing? Vitamin D and calcium. Is it? They
well,
say
it
you should not
depends
take
on.
them at a stretch. Yeah.
No. Some of them, there are some of these medications that will tell you, oh, take for 2 weeks,
Okay.
have a break, take for another 2 weeks, have a break. There are some who will just tell you, okay, take it for a period of this maybe 2-3 months, stop, take for another 2-3 months, stop, or take daily. You know, really, because as someone even ages, there are some nutrients that we are meant to be taking to replace some of the things we are not. So, and as long as the person takes them in the recommended dose, there shouldn't be any problem.
So that means we have to have a conversation with our doctor before we start taking some.
Definitely, they will be the ones to know this is what you need. Recently, I saw a woman who came and told me that what she wanted was the estrogen patches. She doesn't want to use the tablets or the injectables, hormone replacements. But those patches are not very available around. So those are another option. I know someone who procured it from the US. We'll just put it under the skin, under our tummy for some time, and it worked for her. So there are various options available that would take care of all these problems that will occur afterwards.
Thank you, sir. Me, I think I will take exercise, fruit, and supplements for myself. Thank you so much. Again, my book Fighting Fibroids is available for those that are here and those that will watch later. I shared my story, and I think somehow it will help and encourage somebody out there. Thank you so much for everyone that showed up here. We really appreciate you taking the time to come. And Dr. Ayeni, I'm so appreciative of you taking the time out of your very busy schedule. We're going to be putting this up on YouTube and sharing. So I'll be collecting your details later so that people that may have more, you are the expert here, let them reach out to you for questions and concerns. Thank you so much. Have a very good afternoon, everyone. Thank you. Shogo, are we good?
We are good.
You have taken the picture.
Yes, I have.
Thank you. Bye. Have a good afternoon. A good afternoon, everyone. Thank you.
Yeah, bye.
I guess I can stop the recording now, right?
Yes, because we were so
okay. So I'll press this. I'll have to edit this. Leave the call. No. Abio Esheo. Esheo.
We are just afternoon. No.
Thank you for the support, my dearest darling husband.